Speak to the whole world about my mercy. Good morning, everyone, and welcome to Divine Mercy Sunday. I would like to introduce our organization, Nurses for Divine Mercy. Our mission is to care not only for the physical needs of our patients, but also for their spiritual needs. I founded for the Nurses for Divine Mercy as a direct result of the September 11th tragedy. Our team of parish nurses from St. Anne's with the American Red Cross were to go to help in New York City. Just as we were about to leave, our unit was called to a halt as there were so few survivors. Almost 3,000 people lost their lives that day. I realized the best care we could give those trapped and dying was to pray the Divine Mercy Chaplet. I wanted to share this with other nurses, healthcare workers, and everyone as the tremendous answer of what to do when you can do nothing physically, in the middle of a tragedy or with a medical situation that is serious. I love being a nurse. I'm here as a spiritual nurse advocate for every single injured person in the world who needs your prayers through the Divine Mercy message and devotion. The spiritual care of the sick and injured should have first priority in conjunction with physical care. This is often overlooked by medical professionals who may not be trained to call for a priest or pastoral care on a timely basis. This is a spiritual emergency, and it's everyone's business to make sure the sick and especially trauma patients who cannot speak for themselves receive the spiritual care that they need. It's up to you, and I repeat you, who already have been blessed with the Divine Mercy message and devotion, to teach professional nurses, physicians, healthcare workers, or family caregivers how to use the message of mercy. Jesus is worthy of our trust. So sharing the promises of Jesus that he gave to us in the Divine Mercy message and devotion, in caring for the sick, the injured, and dying, is an act of our own trust in Jesus. Father Seraphin Mikolenko, a Marian from Stockbridge, who was the postulator for the canonization of St. Faustina, was the first to tell me and point out that the nurse, when uniting their hearts with the passion of Jesus, becomes the merciful presence of Jesus at the bedside of their patient or by praying for those far away. Our hands become his hands. Our heart, Jesus' heart. Our lives carry the message of mercy by our very actions. So when we go to see a particular patient, we are humbly reminded that Jesus, the Divine Mercy, is walking within us. We invoke Our Lady as the heavenly nurse and ask her to guide us in how to use the Divine Mercy message and devotion with our patients near and far away. Many times, I only had prayer as a recourse of treatment.